Welcome everyone. We're here today with one of our physicians to talk about deep vein thrombosis, and I'm going to ask him to introduce himself.
Hi, my name is Jack McCallum, and I'm a vascular surgeon at Valley Medical Center.
Let's start with our first question. What is deep vein thrombosis, or DVT?
Well, taking it in pieces, a thrombosis is a blood clot, and the deep veins are veins that run deep inside of our arms and legs with the arteries, and so a deep vein thrombosis is a blood clot that occurs in one of those veins. A related condition is called pulmonary embolism, which is when one of these blood clots breaks off, travels through the veins, and lodges in the lungs. We often talk about DVT and pulmonary embolism together, DVT and PE.
What are the symptoms of DVT?
The symptoms of DVT are pain, swelling, and sometimes redness in the affected arm or leg.
What causes DVT?
Often we never know exactly what causes a specific DVT, but we do know that there are things that put people at increased risk of having blood clots generally. Blood clots start when there are activations in the clotting factors and platelets within the blood for some reason, and once a clot starts to form, it often snowballs and forms a bigger and bigger clot as time passes, and that sticks to the walls of blood vessels. That's how we think DVTs start.
Who is at risk for having DVT?
There are many things that increase the risk of developing a DVT. First, immobility, such as not moving, not walking, such as happens on a long plane ride or having been in the hospital for some period of time. Damage to the walls of veins, such as happens following a traumatic accident, such as a car crash. Certain conditions predispose people to developing DVTs, such as certain inherited conditions that make clotting in the blood more likely. Also, certain types of cancer increase rates of blood clot formation. Also, COVID-19 increases blood clot formation. Smoking, pregnancy, and obesity all increase the formation of DVTs. Having a catheter, called a central venous catheter, promotes the formation of clot and DVT as well.
How is DVT diagnosed?
Because DVTs are common and the symptoms are common, we often suspect a DVT anytime that there's arm or leg swelling or pain. To confirm the diagnosis, an ultrasound is obtained of the veins in the affected arm or leg.
How is DVT treated?
Almost all DVTs are treated with anticoagulants, also known as blood thinners. Blood thinners reduce the risk of further clot formation while the body breaks down a clot on its own. The body is always forming and breaking down clots, and blood thinners help break the cycle of clot propagation or growth. Rarely, in certain cases, surgery is needed for severe DVTs.
What are possible complications of DVT?
The most feared complication of DVT is something called pulmonary embolism, or PE for short. In PE, a piece of clot breaks off from a vein, usually a vein in the pelvis, travels through the veins and lodges in the veins in the lungs. This can cause shortness of breath, chest pain, and in severe cases, sudden death. Other complications of DVT include something called post-thrombotic syndrome, which is dysfunction of the veins in the legs. This can lead to chronic leg swelling, changes in the skin color and texture in the legs, and in severe cases, wounds that slowly or fail to heal in the skin of the legs.
When should you seek treatment for a DVT, and who should you see first?
Anytime anyone develops pain and swelling in one of their arms or legs, particularly if it's just on one side and not on both sides, that's a big warning sign for DVT. Anytime that happens, you should reach out to your care provider urgently, and if you don't hear back in about 24 hours, you should probably go to urgent care. There you can be evaluated and assessed, and a lot of the time it won't end up being a DVT, but because DVTs can be so dangerous, we recommend that you advocate on behalf of yourself for care relatively urgently. We understand, and it's okay to reach out and ask for care urgently in this situation.
What can people do to try to prevent DVTs?
One of the best things patients can do to prevent DVTs is to be active. If you're on a long voyage, such as a transcontinental plane flight, I recommend that patients get up and walk around for 5 minutes every 1 to 2 hours. Similarly, if you're on a long car drive across multiple states, stop every couple of hours and have a walk around. If you smoke cigarettes, you should stop. Smoking cigarettes increases the risk of DVTs among lots of other health reasons. If you're in the hospital or a family member or loved one's in the hospital, you'll often see them administered a dose of blood thinners, often as a shot, and this helps reduce the risk of developing a blood clot like a DVT while a patient's in the hospital. So that's normal standard practice, and you may see that in your loved one's care at Valley.
Thank you for answering our questions today, Dr. McCollum. And for those of you watching, if you'd like to learn more about our vascular surgery services, we encourage you to go to the link below.